Good afternoon. My name is Scott McGann. I'm health agent for the town of Falmouth. Today's July 24th, 2020, and we're doing our weekly COVID-19 update. Again, health@falmouthma.gov is our email, falmouthmass.us is our website, and our phone number is 508-495-7485. As of July 24th, there are 222 confirmed cases of COVID-19 since the beginning of the outbreak, our first case being March 19th. There have been 18 confirmed cases during the 14-day period from July 10th to July 24th. 11 of the 18 confirmed are located in the long-term care facility. So yesterday we had an increase in the long-term care. So that leaves us 7 for the 14-day period that are not related to a long-term care facility. As of July 22nd, because this is done weekly, every Wednesday the state gives us this information, the 14-day total tests performed in Falmouth were 1,093, which represents a positive test rate of 0.37%, which is quite low. And that's, again, based on the count of 208, because that was done on Wednesday when our case count was 208. So we've had an increase over the last couple of days, the vast majority being them in a long-term care. We're still around 13% of all cases in Barnstable County, with 14 being expected. And again, the VNA and the CTC at the state and DPH, we're still working on, obviously, the contact tracing and quarantining and isolation, as we should be. Our weekly case trend, you can see, of course, that it is higher this week. If we did not have a problem with the long-term care, we would be down in sort of where we were, a little bit higher than the last 3 previous weeks, but more in line with sort of the mid-June to early July numbers. We would have been around 7, so it would have been a little on the high side even for that. So we've had about 7 cases roughly in the last couple of weeks. So it would have been somewhere around 5, I think, for this week. So it would have been somewhere in that range where we had been. Again, with the long-term care, that has made that higher, and we're in that at the higher rate right now. Again, you'll see that, and if you look at this slide here, you can see that in late March, early May, you saw that very quick increase at the beginning, and then you see an increase again right around the mid-May area, which was due to long-term care, and you're seeing another one here. That could be due to both. We don't know yet. I mean, definitely long-term care, but, we have been getting a few community transmission cases, like I just said. So as far as the state dashboard goes, every day after 4 o'clock, the state updates the dashboard with the daily counts. And so some of these slides that I get you are from the daily. They also do a weekly every Wednesday. So some of it data will be from Wednesday the 22nd. Some will be from yesterday the 23rd. We've been averaging about 150 to 175 a day. Yesterday we were at 270, but the number of tests were also really high. 16,000 daily tests is quite high, which is also leading to an issue with turnaround time. The labs are struggling to get turnaround times, and it's making the test, getting your results a bit on the long side than it had been in the past, and that's because labs just can't gear up to sort of that sort of level of testing. But we're at 16,000 daily tests. Number of deaths was 16. The number of deaths for the day was 16. The total deaths since the beginning is 8265, with a total confirmed case number of 107,683. The case trends remain the same, green and yellow trends. I'll talk about that in a minute. Here you see the county. This slide came from the county back on the 13th, that we were doing a bit better than the state in terms of all our metrics, with our healthcare system readiness being better than the state average, and also our contact tracing capabilities being a bit better than the state average. So there's a couple of areas we were doing better. And our 7-day rate positivity was 1.0, at least back in the 13th. This slide hasn't been updated by the county, so this is maybe a little bit dated. Next, you'll see from the county, this is just total number of cases through time. You can see that starting in late March, early April, it started to go up. It hung high until about mid-May. It started to go back down. By Memorial Day, you started to see a lot lower numbers, but then again, look at July 18th recently you start seeing an uptick go back up in cases. And of course, we have 2 times the amount, maybe 3 times the amount of people here. And so we have more activity, more things going on. Perhaps people may be taking it a little bit more lightly, as things were good for a while. Not quite sure, but we are seeing, at least at the county level, an uptick. You might have heard the party down in Chatham, and there's going to be a pop-up testing site for that, for people that attended that party. So you do see some cases, there's some upticks here and there. Hopefully that it doesn't get too bad, that we're able to manage those. The state averages, our percent positivity got as low as 1.6 on the 19th, and it's 1.8 now. Hopefully that trend flattens back out. You do not want to see that number get, definitely not above 2. We'd like to see that number continue to decrease, and but we do see a slight uptick from 1.7 to 1.8 over the last couple of days. Some good news is the hospitalization numbers dropped quite a lot for a day. Our surge capacity sort of goes up and down, depends on whether the hospital has a lot of patients. The hospital emergency rooms are not just full with COVID patients, so sometimes those COVID patients have to go to surge capacity, so you'll see that number fluctuate quite a bit. And number of deaths is still on a downward trend. Looking at the county numbers, we're at 1668. Okay, for the county, that's up 75 since the 15th. You can see where I just showed you in a couple previous slides a lot better, but you start seeing a little bit of an uptick that I circled here. And same happened earlier on in July in both Dukes and Nantucket County. It looks like they've kind of flattened out their curve a little bit. I guess that's probably going to happen when we have quite a bit of people, especially in Nantucket and Dukes counties, the Vineyard. That also definitely could happen because the population just goes up. More things can happen. Some good news is testing and incidence rates. So back up, this is valid as to the 21st. If you see here, this is the incident rate. The lighter the color, the better. And I'm circling Falmouth with my mouse here, the pointer, and it shows that we have a lower than average sort of state for our area incident rate, but we're very dark on testing. So we're robust in our testing, and that's why we got the 0.37 at least up until the extra cases that we got that made us to 222 happened just after all this. The state did these charts. That might be adjusted slightly, but you can see where we're testing a lot and not finding a lot, and that's what we want to continue to see. As far as COVID cases, we have 1,285 more confirmed cases between the 15th and the 22nd. We have 1,000 people released from isolation. We've gone up 97 in deaths in that time frame, and 126 in currently isolated. So our net, because you're going to lose isolations, releasing, and so forth, we have a net increase of 126 total people on isolation. Again, this is part of the state's website on the weekly update that comes out Wednesday. If you are looking at these charts every week, usually Wednesday takes until 5 or 5:30, not 4 o'clock. It's because they're also redoing the weekly update. So where our numbers were 208 at that time, we had a slight increase. We're averaging only 4 positives for 14 days. The 1093 tests, like I showed you before, total tested was 6583 since the beginning, and 0.37%. The state average is 1.67%, so we were doing considerably better and still are considerably doing better than the state. But, we just got to keep an eye on the things that have happened over the last day or so, especially at the long-term care facility. Hospitalizations, the state sent out a note that said that they've cleaned up some of the accuracy in some of the reporting with the hospitals. They were taking a lot of people that might have come in and said that they might have COVID, and then the hospital might be counting those as cases. So they've cleaned up the reporting, so there was a big drop in the cleaning up of the reporting that brought it down to 181 less that day. Those people, those numbers, I'm not quite sure why they got to that. I don't do that for the state. So, but they show a big drop off, but they do have a note in there that said they basically cleaned up the accuracy in the reporting. From June 26th, it's a drop of 471 hospitalizations, daily hospitalizations. We're down to 351. I looked at 723, Cape Cod Hospital had 1 hospitalized, none in the ICU. Falmouth had 0 and 0. That changes every day, obviously. That'll go up and down. But the numbers have been consistently, less than 3 for the most part, hospitalizations, and 1 or less ICU now for probably the better part of a month. So that trend continues in a good direction. As far as week to week, from June 26th, it's down 115 as far as current cases in ICU. We're down to 59. And you can see that's been dropping off. Intubated is down at 30, which is great, and that's down 71 people from June 26. So the hospitalization portion is still doing okay, and that's what we want to see. Long-term care, you can see that still about 65% of all deaths have been associated with long-term care. They've had over 5,398 deaths. Looking at our assisted living facilities, we've had 14 deaths. The new cases we've had has been at the Royal McGann. You can see 15 cases there. But, and so there's been an uptick there. The rest of them, there hasn't been any. And so that, we just keep track on that really close. They work directly with the DPH, so the VNA that does our contact tracing, they'll assign an epidemiologist from the state that'll work with the facility, and that's what they're doing right now. So they're gonna be doing isolations and so forth at the Royal McGann. As far as COVID testing goes, again, Falmouth Hospital has it, and still, as far as I know, at Cape Cod Community College is doing it in Barnstable. The hours look like they're 9 to 5. You'll have to make an appointment, and you'll have to have a doctor's note on that one. So that is for that testing. Also, there's the Cape Cod Healthcare Dedicated Call Center at 508-862-5595. And your physician would actually call that number to make an appointment for a test. Also available at some pharmacies. I know the East Falmouth, the one in Davisville, does it. And walk-in clinics do it, and I believe they don't need a doctor's note because they have a physician on staff at the Convenient MD, places like that. There's some free pop-up testings. Actually, there was one now for the people that might have attended that party in Chatham. There's 8 cities that they do it, that they've had the higher rates of infection. The closest to us would be New Bedford. There's going to be more testing popping up. There's been some problems getting some of the supplies for some of these rapid testings and so forth. But you can still do the standard testing by calling your physician, getting a phone call, and going down and get tested. Unfortunately, with the volume, there's been a bit of a delay, and you might have heard that they're going to allow pooling of test results. Essentially, what that means is they pool a certain number, let's say 100 different COVID tests together. If it hits positive, then all 100 would get tested. If all 100 were negative, they would just not have to continue to test, and that would save 99 tests. So that's kind of what they're doing to help pool results, and then help with the speeding up of the labs and their lab's ability to do the testing. So that's what we have on that. We're still in phase 3, step 1. That began in July 6th. It's still, things are open like gyms, museums, sports, without spectators, pro sports, youth and adult sports. Like tonight, the Red Sox play. There won't be anybody in the stands. I heard they may have some cardboard cutouts and background noise and things like that. Some human services programs have been open. Long-term care visitations on the indoors, casinos. There's some indoor gathering of 8 per 1,000 if you're not already part of a different order. So a grocery store doesn't have to apply to that. It's because they've got their own individual orders. Max of outdoor as well. And again, that's still where we're at. It has no indication of when we would go to phase 3, step 2. So we've been in that. We've been in this since July 6th. So that's, over 2 weeks. And so we remain in this. And I don't have any indication of when we'd go to another step or back for that matter. I'm not quite sure. So that's where we'll be. We'll probably be for a while. As far as social distancing and face coverings, obviously the last thing we want to do is undo the hard work that's been done since late March, early April. The health department receives a lot of complaints regarding social distancing and face masks, and we follow up with all of them as we can. We prioritize the indoor complaints first, but we do get quite a bit, and we have staff that are dedicated to follow up on complaints of social distancing and face coverings. Continued diligence. Social distancing is still important. We can't let off the gas on this. It can jump up real quickly. And unfortunately, the way testing works, a little bit of delay in the incubation period, it takes a while to know what's going on. So we may not, if we get lax, it may take 2 to 3 weeks to know that we've essentially, screwed up. So it's really important that we continue with the diligence on that. Hand washing, hand sanitizing, staying home when ill, following all the state guidance. If you own a business, following the guidance, not letting up on the gas. Today, the governor just finished up a press conference that I don't have a lot of details on yet, but starting August 1st, there's new travel guidance from Massachusetts requiring a 14-day quarantine. For most of out-of-state areas, there'll be some form that will need to be filled out if you've traveled. This would not count for any of the ones that are considered low. So going from New York or Rhode Island probably would not. The same thing we have with the New England states now, but, flying up from Florida or some other place, or Brazil or something of that nature going on vacation, is going to require a 14-day quarantine and some paperwork. It's important that we don't import back either people traveling to vacation that live in Massachusetts or people that come here on vacation or here to visit for any particular reason. We don't want to start spreading and reseeding different areas that are doing well. It's really hard to do, but it's important that we're able to do it. Again, as a recap, the state rep metrics remain flat. I mean, it's pretty flat. It's been kind of the similar numbers now for a month or so. The Falmouth and Cape cases, it's a slight uptick. I wouldn't say it's a giant uptick. The uptick that we've had again in Falmouth, most of that, was long-term care. As cases come, we jump on them as quickly as we can. We do our, contact tracing efforts, and do our best to keep anything that may pop up to a dull roar as opposed to a spike. Our current level of mass remains at phase 3, step 1. So that's what I have for the week, and thank you.